It's been nearly 8 years since I started making autism videos on YouTube, and it didn't take very long for viewers to start sending me links to other people's autism videos that they wanted me to comment on or to offer an alternative take. My commitments outside the channel make it difficult for me to react quickly enough to news stories or trends to catch the wave of interest, and most of the videos I'm asked to rebuff, critique or expand on are time sensitive. This one's a little different though. I watched this SciShow video a couple of hours after it was uploaded because I'm subscribed to the channel, so I was already familiar with it when the first of several viewers messaged me about it over the following days. The autism spectrum might not last. The story is about some research papers published last year that suggested new ways of categorising and possibly assessing autism. So it's not exactly new news, even if a lot of viewers wouldn't have heard about it previously. But SciShow is a deservedly popular channel, and so this video was given the story a new lease of life. So I decided to postpone the content I had planned until next time and talk about this while it's still fresh in people's minds. I'm Quinn, and I'm autistic, and this is Autismatic. So, are they right? Are the days of the autism spectrum numbered? I've been subscribed to SciShow for a long time. They're entertaining, engaging and informative, and they take the time to do the research and present what they find responsibly and sensitively. Whilst they report on news stories, they also make videos with lasting value that serve as easygoing guides, introductions or explainers to worthwhile sciencey topics. I'm glad they chose Savannah to present this video. If you're going to publish a video called The Autism Spectrum Might Not Last, the least you can do is put an autistic or ADHD presenter in front of it. Top marks there. If the title or thumbnail's changed since, by the way, don't worry. I'll link it for you in the description and above if you haven't seen it or you want to refresh your memory of it. So, let's set out the stall for what we're doing today, shall we? I'll obviously borrow a few fair use clips from the show that started the conversation because this is a critique of sorts. But we're not reviewing SciShow's quality, presentation or general content today. That's fine as it is. We're talking about the subject matter being reported on in this video alone. And I'd be happy to chat with Savannah or the team on the channel if they ever want to have a yarn about it. I'm all about the open exchange of ideas, and I know they are too. If you haven't seen the video I'm going to be talking about, you'll get the gist here obviously, but I'd still recommend giving the original a whirl to fill in any gaps I missed. The subject of what we collectively choose to call autism, or any subcategories of autism, is one close to my heart because of the vintage of my diagnosis. My autism has worn many names already. Long story short, I was diagnosed with what we'd eventually call autism spectrum disorder back in the mid-1980s, over 40 years ago. I was a bright, shy but opinionated schoolboy who didn't like doing my homework or turning up to detention, so I got sent to an educational psychologist to straighten me out. After months of sessions with different specialists, I ended up with a young, enthusiastic new recruit to the team. He was fresh from reading Lorna Wing's pioneering papers discussing a broader spectrum-type view of autism, and after a few more weeks, he furnished me with the label of Autism Asperger type. About 20 years later, an NHS psychiatrist trying to help me with my troubles of the time told me that Asperger syndrome, or the cutesy-sounding ASPI, suited me better. When it gets mentioned in my medical records these days, it's listed as ASD, or Autism Spectrum Disorder. So, if the powers that be have any plans to change my designation yet again and give me a shiny new label to put on my autistic badge of office, I want to know about it. The SciShow video breaks down into two parts. They're reporting on a recent proposal for categorising autism differently, which breaks away from the one big autism spectrum model we kind of work with currently. According to the quoted articles you'll find linked in the SciShow description, the proposal is in line with current observations from medicine, psychology and sociology, and it's supported by early genetic evidence pointing to potential biological dividing lines between distinct subtypes of autism. The rest of the video makes the case for why change might be needed. It's widely acknowledged that the autism spectrum as we know it was an important stepping stone to better understanding, but now we do understand more, it's no longer as useful as it used to be. Perhaps this new series of classifications could help to improve outcomes for autistic people. So, let's start watching it, shall we?
In this video, we'll use the terms autism spectrum disorder and identity-first language like autistic people, but please know we respect whatever terms you choose to use to describe yourself. And some people refer to autistic symptoms as traits, because symptoms might imply there's always something wrong that needs to be fixed. In fact, many autistic people feel they don't need to be fixed, and neurodiversity is fine, actually. The papers we're talking about today refer to them as symptoms.
Well, the introduction to the video does a great job of being inclusive by telling us they'll be using identity-first language in line with the majority expressed preference of autistic people, but that they respect other preferences too. And it explains why they use the term symptoms throughout the video, because that's what the papers they're reporting on call them. Personally, I always prefer to say traits, characteristics, behavioural biases, that kind of thing, but I do get their point. They don't need my approval, but they have got it.
Like every new concept, these categories started out as an idea based on a limited set of data. But as the researchers sought to test their categories, they found validation everywhere they looked. Parent reports and clinicians supported these classifications, and a totally different sample population of autistic people also fell into the same categories.
Okay, I'll stop that there. There's a glaring omission from that statement, and it's one that's sadly quite typical of this type of research. Parent reports and clinicians' reports supported what they were doing. But what about patients or service users' reports, if we're going to stay with clinical terms? Or, in plain but polite language, how many autistic people did they ask before publishing their papers? Now, Savannah does pick up on this point at the end of the video, that there wasn't any autistic input into the papers they were reporting on, and that's a big no-no right from the start. If you've watched my work before, you'll know how strongly I feel about such exclusion. It smacks of contempt for the very people they claim to be acting in the interests of. A scientific let them eat cake. I personally believe that all autism research should be autistic-led wherever possible, and that a number of autists should be on every advisory board, ethics panel and funding committee for all autism-related research.
The evidence for these categories isn't just behavioral either. The researchers found genetic differences among the 4 groups that support the establishment of the new categories. Each of the 4 groups had genetic profiles that resembled each other and were unlike that of people in the other groups. So if you only looked at everyone's genes, you'd have a good chance of putting them in the same categories as if you were basing it on their diagnostic tests. For example, people in the social behavioral group generally had genetic variants that other researchers have already linked to ADHD and depression.
Clear, genetically verifiable differences that can identify not only the presence of autism, but the type of autism a patient has? Wow, that's an astonishing trick if they can pull it off. Right now, an autism diagnosis is just a fancy opinion. It's made official by the qualification and position held by the practitioner, but it's still just an opinion. Maybe that's why there's so much emphasis made in the papers of how well the genetic evidence seems to match up with the observations made by parents and clinicians. It offers objectivity where now there is only subjectivity. But there's also a high risk of mistaking correlation for causation in our enthusiasm for clear-cut answers. I'm always very wary of gene tests claiming any kind of positives when it comes to autism. I'll leave it to more scientifically gifted writers than myself to get into the nitty-gritty of why that is, though. It's fair to say that whenever I see bold claims in the press of breakthroughs in autism genetics, I have to take a deep breath and search out the actual papers supporting it. And I've not yet seen one that was genuinely worth all the media excitement or the sweeping headlines. Many projects are based on tiny patient samples, or research on lab animals artificially stimulated to exhibit autism-like behaviour, even just cell cultures in some cases, and conflicts of interest with paid lobbyists, big business and flexible political operators is rife. However we go about conducting our autism gene research, we're still looking for genetic needles in biological haystacks. Impossible, haunted haystacks that keep moving and changing size and shape, because we haven't actually nailed down what autism is yet. What? You think we have? Okay, well, look, why are we having this conversation then? Are we not talking about a bunch of scientists thinking they have a new way to catalogue and define what autism is? Doesn't sound to me like that's settled. I've spent 8 years just on this channel correcting and debunking an ever-growing fog of popular and political misunderstandings, rumours and bad science surrounding autism. So please forgive me if I don't see it as a particularly stable foundation to be building on right now. If we wanted to look for the genes for red hair, then we've got a target. We get genetic material from a load of redheads and look for the genes that only they have all in common. But you can't do that with autism. Not yet. Because we haven't come to a final decision on what autism looks like yet, or how to categorise it. If Uta Frith, who helped create the spectrum in the first place, had her way, as I talked about on the channel recently, then my 40-odd-year-old diagnosis would go up in smoke. So what would happen to the studies of my autistic genes then? Do they get thrown out now?
So the researchers point to the genetic evidence as further support for these 4 categories. It might also help explain why people who fell into different categories were generally diagnosed at different ages. Now, the age that you're diagnosed depends on a lot of factors. Too often people are living with symptoms for years before getting a diagnosis due to social, cultural, financial, or other reasons.
Okay, now this age of diagnosis point is an interesting one. I made a whole video more or less devoted to this. I'll leave links in the usual places. Age of diagnosis might well be a useful metric in, say, 50 or 60 years' time, but right now, it's an impossibly flawed factor to consider. As Savannah rightly points out, there are a number of social, cultural and financial barriers that can delay or even prevent someone getting diagnosed. Statistically, women and girls have found it more difficult to obtain diagnosis too, but there's more to this story about age. Nobody disputes the figures. There's no doubt about it that there's a lot of older people getting diagnosed and plenty of folks self-identifying too. Usually, though not exclusively, whilst they wait for a formal diagnosis. There has to be some reason why they didn't get spotted earlier. Well, there is. And you don't need a single geneticist to find it. You need a historian, or someone with basic internet search skills. You see, it doesn't actually matter what your gender, education, financial status, or even where you live. Your likelihood of being diagnosed as autistic when you were a child of any age diminishes rapidly if you're over the age of about 35 now, and if you're over 45, it's next to impossible. Why? Because the autism spectrum we know today and the Asperger's syndrome that opened the door to so many of the diagnosed autists of today probably didn't exist when you were a child. There were test cases to prove the concept in the decade or so between it being proposed and accepted, but except for a few thousand exceptions worldwide, myself amongst them, nobody got anything like an Asperger's syndrome or an autism spectrum disorder diagnosis before the mid-1990s, only 30 years ago. Both diagnoses were added to the diagnostic manuals in the 1990s, 1992 in the ICD outside the US and 1994 in the DSM in the US. And even then, it took several years for any knowledge of this new kind of autism to spread through doctors, paediatricians, and eventually educators and politicians to make early identification even feasible. Anyone who left school before about 2000, say, is unlikely to have been spotted as potentially autistic as a child. Lazy, quiet, argumentative, obdurate, insensitive, thoughtless, inappropriate, or a million other unwanted and unfairly assigned qualities, yes, but autism? It was barely known outside of that film with Dustin Hoffman. You know the one. No, not that one. No, or that. Oh, for Pete's sake. Yes, that's the one. Yes. Even now, We can't decide what should go into the diagnosis itself, can we? I mean, that's what this proposal we're talking about is all about in the first place. Shifting the autism goalposts. I don't personally see how we can include age at diagnosis as a reliable indicator, or even worth looking at, unless we've got a level playing field across all ages. Until we can say with reasonable certainty that everyone was diagnosed and classified under a similar and consistent set of criteria, age of diagnosis is a poor indicator at best.
And with these new categories, people might even have an easier time accessing therapies that work best for them. We know from a survey answered by 200 autistic adults without intellectual disabilities that finding the right support is crucial. Some of them shared what it was like to work with mental health professionals who didn't get what their flavor of autism was all about. More than half of the people surveyed reported unmet mental health or social support needs. But getting the right kind of support turns out to be as important as getting it at all. Survey participants reported that getting therapy that turned out to be inappropriate for them was disempowering and made them feel worse.
Overall, Savannah made a fine job of making the case for why change is needed, given the limitations of the 10-minute format. They do a great job of explaining that autistic people the world over are crying out not just for recognition, but for better availability of care, guidance and opportunities that aren't yet forthcoming. They rightly point out the difficulty so many of us have finding worthwhile help when things get too difficult for us, something I keep banging on about here on Autistic. Many doctors and therapists simply aren't up to speed on how to provide even basic appropriate care for autistic people, because they just don't know enough about how our minds work. I spent 20 years of my adult life going through the system trying to get help to make things easier for me and to break the cycle of burnout and depression I was in, and I had to give up in the end. In the long run, they did more harm than good, I'm sad to say, and I'm not alone. The solution is obviously to learn from autistic people directly, not just by observing us and theorising what might be going on. We should match autistic patients with autistic therapists wherever possible, and that's more viable than you might think. And we should do our best to tailor the care we provide to the individual needs of the person needing help. One size fits all isn't working. Except it's not quite one size fits all after all. There actually is an existing framework of subcategories in place already, based on care needs and graded from 1 to 3. Autistic folks who lead ordinary lives with jobs, families, responsibilities are usually a 1 or 2, while someone in a care home or assisted living would likely be in category 3. In theory, it's based on how much time or assistance we need from a third party to lead a normal life, which, in practice, boils down to a severity scale. It's still mild, moderate and severe in practice, just with numbers on it. It's a cold hard fact that autistic folks who exhibit challenging behaviours are far more likely to be graded higher than quiet, introspective autists. That's the system everybody is saying is not fit for purpose, and we're all agreed needs rethinking and replacing with something that provides better potential for targeted support. We need something that's more granular than a severity scale, something that gets to the root of an autist's real problems, so the medical profession has better tools to provide care when it's needed. We know that autism isn't linear itself, so linear scales are out. Try as we may, neat grades of how much autistic aren't a viable option. So, what are these 4 new categories under proposal then? First, they give us the social and behavioural category. They tell us that this makes up just over a third of us, and it describes those of us that have primarily social or attention issues and a propensity for anxiety or depression. They're the ones who get the latest of late adult diagnoses because they had no co-occurring conditions or developmental difficulties except for perhaps depression and maybe ADHD. Unlike the moderate category, a slightly smaller third of our number who seem, as far as I can tell, to be the least clearly defined. They have more autism characteristics than the socials, but none of the social difficulties, and their traits are less extreme than other tiers. However, they also get diagnosed late apparently because they also don't get any co-occurring conditions or have any developmental hiccups growing up. Specifically, they don't get anxious or depressed, they say. So perhaps we should call this bunch the happy autists. Then we move on to mixed autism spectrum disorder with developmental delays. Totally agree with you, Savannah, that's too much of a mouthful. This 20% or so of the survey group is described as basically being like social autism plus moderate autism with maybe the odd developmental disorder thrown in. Unlike the socials, though, this mixed bunch are another cheerful crew who don't get anxious, depressed, or have ADHD. The final 10% they called broadly affected. They're the only category for those of us who get co-occurring symptoms other than ADHD, anxiety, or major depression. They are also the most broadly affected by their autism traits. Make of that what you will at this point. If you didn't know there was minimal autistic input into this scale, there's a massive clue there. It's just one word: moderate. Moderate isn't a word that exists in isolation. By its very presence, it implies extremes at either side of it, and in doing so, it speaks volumes about the intentions of the people who use it. High, moderate, and low. Hot, moderate, and cold. Mild, moderate, and severe. Before we've even examined this proposal's premise, before we tuck into the meat and potatoes of it, that one word is a huge indication that this could be another severity scale, just like the one we're all agreed is failing. Further examination doesn't change that impression, though. This isn't anything new. It's just business as usual, dressed up in new, shiny genetic colours. So, why are we discussing a proposal that's basically exactly the same tired and dysfunctional system we already have dressed in new clothes? And why does the fourth category, this broadly affected one, sound practically identical to the highly controversial profound autism category that ABA companies, political lobbyists and martyr moms have been peddling for the last few years? This new system is a severity scale, but with 4 grades instead of 3, including a barely autistic, basically just anxious category at the top. Then you have 3 grades of proper autistic people graded by their severity, and only one of them allowing for both developmental delays and co-occurring conditions, outside of depression and ADHD. How's any of that going to make it easier to get help than what we've got now? The most grievous failure of any system to categorise and separate is when it's not up to the task. And I'm a walking, talking example of that. Most people would think to put me in the social category. I've worked all my life, held down friendships, I'm married, and I run a YouTube channel where I make videos about, amongst other things, anxiety and depression. So I'm a social autist then. Easy peasy. Moderates don't get anxiety or depression, which I've had many a time, or have ADHD traits, of which I have many, so that's completely out. But I do have a learning disability. I'm dyscalculic. I have coordination problems too, though below the threshold for a dyspraxia diagnosis. When I was a kid, I didn't start walking until more than a year after my peers, which had my mum and dad taking me to the doctors, worried my legs didn't work properly. Does my developmental delay put me in the broadly affected category now then? And I have a number of well-known co-occurring conditions too, like joint and connective tissue problems, digestive difficulties and migraines. I even have a couple of autistic traits that were misdiagnosed as medical problems before. That definitely sounds like the broadly affected category, or am I missing something? And what about my sensory issues too? Where do they fit in? If someone who has lived with an autism diagnosis for over 40 years of their life and has devoted their life to studying what that means can't decide what category they fit into, what chance has anybody else? At the end of the video, Savannah points out that there are lots of ways of looking at the question of how best to categorise autism, and there are other suggestions of how we might do it that are worth looking at too. I agree, and I think we need to, because this new approach turns out to be nothing new at all. It's just the same old with all the usual political and business-friendly principles intact. They've just tacked on some selected genetic data to lend it scientific credibility in, it's got to be said, an area of science few people really understand enough to criticise, and they hope that we wouldn't notice. So, what would a good system of categorising autism look like? We know from what we've talked about today that it wouldn't be trying to herd us into severity-based lanes. It wouldn't be based on or evidenced by parent feedback and clinical reports, at the exclusion of the living, breathing, thinking, feeling people you're trying to categorise. Nor would it be providing easy avenues for money-grubbing politicians to continue ignoring autistic folks at one end of their scale whilst claiming those at the other end have needs too complex to understand or cater for. What it would be is autistic-led for a start. It would be based on our needs and our difficulties, not the challenges and inconveniences we seem to present to other people. It wouldn't be linear because the autistic experience isn't linear. It would allow us to address the unique combinations of traits and co-occurring conditions of each individual autist and address them individually and in combination to make the care and development of each and every autist a one-size-fits-one experience. But above all, it would have to actually show real potential to make autistic lives measurably better than they are now, or it's a pointless waste of time. I've discussed the framework that works for me and has helped me make a difference to I don't know how many autistic lives. It's called the Autistic Triad of Distinction. It's an awful lot of work for one man alone, so it takes time, but if you want an introduction to it, I'll pop a link above. Once this series of heatwaves passes us over, I'll be back to do more on the triad and how my understanding of it helps me prevent burnout, so stay tuned if you'd like to know more. Like I said in the introduction, I've used the SciShow reporting of this story because I know a lot of you have seen it and I want to give them credit for a decent, well-presented report on the subject. They've a few neurodivergent folks on their staff and it shows in videos like this, but what they're reporting on is a different matter. I want a better way of understanding the individual needs of autistic people so we can better provide help and support where it's needed. I also know how varied and complex autistic lives are from talking to thousands and helping hundreds of autistic people make sense of their lives in the last 40 years and the 8 years of this channel. But this 2025 proposal wasn't it. This channel is my job, by the way, not just a hobby. So all those subscriptions, likes, hypes and notification bells help. They don't just make me feel good, they help put food on my table too. If you fancy an extra, more personal video from me every week, or you just want to help me continue making quality autism content, then come support me on Patreon too, or bung me a few quid on Ko-fi for a one-off instead. I literally can't make these videos without your help. Next time, I'll be back with the video I originally wrote for today about the extremes of autistic experience. But until then, I'm Quinn and I'm autistic. Thank you for your time.